I am Donna Edwards, and in today's presentation, we're going to be discussing effectiveness of treatment for substance use disorders among persons with first episode psychosis. This presentation has several goals. We present findings on changes in substance misuse disorders in response to generalized treatment for first episode psychosis. We review research that examines the impact targeted interventions for substance misuse disorders on substance use outcomes. We review research that examines the impact of targeted interventions for substance misuse disorders on other important outcomes. We synthesize the findings in order to make recommendations for addressing substance misuse disorders when working with young adults with first episode psychosis. The changes in substance use in response to generalized treatment for first episode psychosis. Research has not fully addressed how generalized first episode psychosis treatment impacts reduction in substance use. It could be that the type of comprehensive integrated treatment encourages behaviors that supports recovery and discourages those that do not. Another possibility is that young adults who experience psychosis attribute symptoms to substance use and stop use in response. When we're discussing the effectiveness of targeted interventions on substance use outcomes, when we look at the research in this area, it's focused on studying interventions that specifically address substance misuse disorders. The studies in this section are all randomized controlled trials, the highest standard for examining interventions efficacy. Unless otherwise noted, all studies reviewed in this section included a sample of individuals with first episode or early psychosis, an intervention or intervention model that addresses substance misuse disorders, an outcome measure pertaining to substance use, example given, toxicology reported, participant self-reported, and a comparison group. Here are 4 tiered rating systems to assess the quality of the evidence. Let's remember the S. S for strong evidence of effectiveness. Effectiveness demonstrated in systemic reviews or meta-analysis of randomized controlled trials. M for moderate evidence of effectiveness. Effectiveness demonstrated in at least 2 randomized controlled trials judged to be a sufficient methodological quality. The L for limited evidence of effectiveness. Effectiveness demonstrated in 1 randomized controlled trial or at least 2 quasi-experimental studies with a matched controlled group and a design that attempts to isolate the effects of the intervention, or result across studies whether randomized controlled trials or quasi-experimental. Our mixed or randomized controlled trials show non-significant average effects in meta-analysis or are limited by significant methodological problems. Example given, inadequate sample size. The N is for no evidence of effectiveness. Effectiveness not demonstrated in any study regardless of study design. In brief motivational enhancement skills, training brief motivational enhancement skills training is a treatment approach that helps individuals overcome ambivalence and develop skills needed to reduce or stop substance use. Studies of brief motivational enhancement skills training for individuals with first episode psychosis tested the intervention primarily in an individual format over 4 to 9 sessions. When we use cognitive behavioral therapy plus motivational interviewing, cognitive behavioral therapy plus motivational interviewing combines CBT techniques such as the development of a shared formulation of substance use problems, psychoeducation about the relationship between substance use and psychosis, goal setting and change planning, coping skills training, and motivational enhancement in order to address substance use problems. Most studies of CBT plus MI for individuals with first episode psychosis evaluated the intervention in an individual format over 10 or more sessions, with several offering at least one booster session. Antipsychotic medications such as olanzapine and risperidone have also been evaluated for their impact on substance use outcomes among individuals with first episode psychosis. Pharmacological interventions. The pharmacological treatments for substance misuse among individuals with first episode psychosis have also been studied. One randomized controlled trial found that there were no differences between those being prescribed risperidone and those being prescribed olanzapine in terms of cannabis and alcohol use in both groups. The use of substances during the study was substantial, 38 to 52%. A systemic review of meta-analysis of the efficiency, accountability, and tolerability of various antipsychotic medications among individuals with schizophrenia and co-occurring substances use indicated that olanzapine was superior to other antipsychotics in terms of reducing the substance use. Risperidone was shown to be more effective than olanzapine for reducing cravings. Now let's talk about the interventions for individuals with first episode psychosis and substance misuse disorder. 7 studies included that this review tested the effectiveness of the interventions only among individuals with first episode psychosis who also had substance misuse or qualified for substance use disorder at the beginning of the study. 4 studies included both people with and without current substance misuse. Out of the 4 studies, 1 demonstrated greater substance use among those who were using versus those who stopped use prior to study entry. 1 demonstrated no differences across subgroups and verifying levels of substances use. And 2 did not compare outcomes based on frequency or severity of substance use at baseline. Identifying the most effective substance use treatments in samples of those with first episode psychosis with varying levels of substance use is a critical area for future research. Using the evidence to guide practice, there are several conclusions that can be drawn from this review. Number 1, young adults experiencing first episode psychosis, even though who enter treatment with substance misuse or substance use disorder should be offered generalized early intervention services. Many will make significant reduction in substance misuse disorder in early stages of first episode psychosis treatment without the need of any additional targeted treatment. Number 2, those who do not reduce their substance use in response to generalized first episode psychosis treatment should be offered targeted substance use interventions. There is limited evidence that brief interventions that include motivational enhancement, skills training, and cognitive behavioral therapy are beneficial. As we await a more robust evidence-based use, these interventions is encouraged, but they may not be sufficient to significantly or quickly reduce substance use. The process of engaging these young adults in substance use treatment is likely a long-term process that folds over time as treatment for first episode psychosis helps young people feel better and identify reasons for change. Treatment focused on addressing problems associated with substance use, example given, social issues, physical health problems, medication adherence, may be most appropriate for those not ready to reduce or stop substance use. Time-limited interventions for substance use might be considered before implementing longer, more elaborate treatments. It is clear from this review that more research needs to be done to build an evidence base for interventions in this area. There are relatively few studies and they vary considerably in approach. In spite of this diversity, the interventions that have been studied share a number of common elements in their approach to substance use treatment. These areas include the harm reduction approach. The intervention aims to reduce a negative consequence associated with substance use and to support person-centered goals related to decreasing in addition to stopping substance use. The decision support materials, the intervention includes educational materials, such as informational leaflets about the relationship between psychosis and substance use, as well as decision-supported tools, example given, decisional balance worksheets, to help the individuals weigh the pros and the cons of various options associated with substance use. Focus on interest and life goals. The intervention assesses individuals' life and community participation interests and goals in areas such as work, school, social relationships, leisure, recreational, spirituality, and health in order to build rapport, facilitate engagement, and help individuals note discrepancies between substance use and goal attainment. Motivational enhancing. The intervention uses motivational interviewing techniques such as open-ended questioning, affirmations, reflections, and summaries to help individuals overcome ambivalence about making change related to substance use. Options for individuals with cognitive challenges. The intervention uses strategies such as frequent repetition, simple and conscious language, written aids, and concrete metaphors in order to engage individuals with cognitive challenges in motivational interviewing. Establishing goals for change and change plans. In addition to assessing life goals, the interventions assist individuals with developing specific goals and plans related to substance use that are appropriate to their current stage of change. The coping skills training. The intervention helps individuals develop coping strategies such as avoiding or leaving high-risk situations, increasing enjoyable activities not involving substance use, and obtaining supports from others in order to change substance use. Relapse prevention planning and problem solving. The intervention encourages individuals to anticipate challenges to short-term achievement and long-term maintenance of substance use change and teaches problem-solving skills to address these challenges. Communication of all team members regarding individuals' goals and plans. All members of the treatment team are informed of individual goals and progress related to changing substance use so that they can reinforce and support the individuals in this area as a regular part of their work together. Follow-up support is a booster session that are consistent with individuals' current stage of change are offered, reinforcing change attempts, refining skills, and further developing relapse prevention plans. You should be asking generalized questions for evaluating substance use disorders. Ask about for alcohol use, drinks per day, drinks per week. Binge drinking for men is 5 or more. For women, it's 4 or more drinks in an approximate 2-hour time period. Heavy drinking, binge use on 5 or more days in the past month. Ask about the use of prescription drugs for non-medical reasons, for a purpose not part of why prescribed, use of any illicit substances. Here is the symptoms of depression in the Patient Health Questionnaire, the PHQ. The PHQ, the interest of pleasure, depressive mood, energy, appetite, concentration, guilt, motor activity, thoughts of hurting self. The PHQ-2, loss of interest, pleasure, depressed, hopelessness. Follow up on a positive response for all of the above questions.